relief. They act on the mu opioid receptors to reduce the cerebral appreciation of pain. They can also be given with paracetamol in the compounds cocodamol and codidramol. The dextropropofen is more potent and reserved for more severe pain. Hello everyone, this is Dr. Mohammed Helmi, and in this recording we will discuss a couple of topics related to pharmacology. They are the analgesics and anesthetic agents, and the second one will be the contraception. The first topic to be discussed will be the analgesics and the different anesthetic agents. The first topic is the opioid analgesics. And opioids act on different receptors, include the mu, delta, and kappa receptors, and all of them are G protein coupled receptors. Some of them are naturally occurring, like the morphine and the codeine. Some others are semi-synthetic, like the diamorphine, and most are synthetic, like the pethidine, fentanyl, and the methadone. The strong opioids commonly used in clinical practice include the morphine, fentanyl, methadone, codeine, pethidine, and the tramadol. These are the different opioids which are known in the clinical practice. The codeine phosphate and dihydrocodeine are commonly used for moderate pain relief. They act on the mu opioid receptors to reduce the cerebral appreciation of pain. They can also be given with paracetamol in the compounds cocodamol and codidramol. The dextropropofen is more potent and reserved for more severe pain. Most of these opioids are considered safe in pregnancy in the recommended doses, and there is a large experience of human pregnancy exposure, so we can use these opioids during pregnancy safely. There are other uses for the opioid analgesics. For example, the loperamide brain barrier, so it does not cause analgesia or respiratory depression, so it's widely used to treat diarrhea. Also, the codeine is an antitussive at subanalgesic doses and can be used in cough medicines. The folcodeine is a modified opiate that has strong antitussive effect but little or no analgesia doses and can be used in cough medicines. The folcodeine is a modified opiate that has strong antitussive effect but little or no analgesia. There are many side effects related to the opioid analgesics. They include respiratory depression due to decrease the sensitivity of the respiratory center to the carbon dioxide. Also, they can cause sedation, nausea and vomiting, constipation, and morphine can release histamine from the mast cells. This can result in itching, urticaria, hypotension, and bronchoconstriction. And in large quantities, they may cause a neonatal withdrawal syndrome. As opioid antagonists, like the naloxone and naltrexone, they bind with high affinity at all opioid receptors and reverse the effect of the opioid agonist, but have no effects of their own. They are used to reverse the respiratory depression in opioid overdose. They can precipitate withdrawal symptoms in opioid-dependent individuals. The naloxone has a short half-life, so repeat injections may be necessary, but the naltrexone has a longer duration of action. Another famous analgesic is the paracetamol, which has both analgesic and antipyretic effects. Of course, it's safe in pregnancy for mild pain relief and simple analgesia, so it is offered as the first-line recommended analgesic. It has very few side effects in recommended doses, but in overdoses, it can cause irreparable liver damage. Another category of the analgesics are the non-steroidal anti-inflammatory drugs. And the non-steroidal anti-inflammatory drugs block the first oxidation step of the arachidonic acid, which is the precursor of all eicosanoids that is catalyzed by the cyclooxygenase or the COX enzyme. What are the eicosanoids? They are signaling molecules that are continuously made in the plasma membrane of all tissues. They are synthesized from the arachidonic acid, which in turn is cleaved from the membrane phospholipids by phospholipases. So we have the membrane phospholipases, and by the action of the phospholipase A2, it gives us the arachidonic acid, which can go in what's called the cyclooxygenase pathway to give us the prostaglandins and the different types of prostaglandins, or can go by a different pathway which is called the lipooxygenase pathway to give us the leukotrienes. The non-steroidal anti-inflammatory drugs, they block the first oxidation step of the arachidonic acid, which is catalyzed by the cyclooxygenase enzyme. So they inhibit the cyclooxygenase enzyme to decrease the production of prostaglandins. We have four major groups of eicosanoids. They are the prostaglandins, prostacyclins, thromboxanes, and leukotrienes. The first three